I'm Dr. Y.P. Raju, President, Cardiologist, Homely Hospital, Hyderabad. As we all know, the heart is an important organ in the body that is often been afflicted with many risk factors like diabetes, high cholesterol, and obesity, or lack of physical activity that all contributing to the heart diseases in the form of acute myocardial infarction and the heart attack, acute stroke, which might be the fatal stroke or non-fatal stroke, and including cardiovascular death and recurrent hospitalization to heart failure. All these disastrous complications are often related to the uncontrolled hypertension, uncontrolled diabetes, and uncontrolled dyslipidemia or high cholesterol, and lack of physical activity, obesity with body mass index more than 24.5, and waist hip ratio more than zero point 0.8 in female gender, more than 0.9 in male gender. All these risk factors say that alone are often in conglomeration with all these risk factors, in conglomeration with excess alcohol consumption, nicotine consumption in the form of tobacco, and animal meat consumption. So these risk factors are contributing to the acute heart attack and acute myocardial infarction. So the prevention is far better than cure. So as we all know, the prevention of the cardiac diseases, prevention of the heart attack and heart failure is more important by two strategies. One strategy is the diet. Diet plays an important role, a pivotal role in prevention of very disastrous and life-threatening cardiovascular diseases. The diet we oftenly, the diet which is most often contributing to the heart disease is the red meat. The meat or the meat or in the form of mutton, animal meat or animal meat consumption, excess animal meat consumption oftenly predisposed to the development of hypertension, that will predisposed to development of diabetes, and predisposed to development of high cholesterol or hyperlipidemia, and predisposed to development of obesity. So all so the excessive non-vegetarian consumption, excessive animal meat consumption, particularly red meat, is more dangerous and more disastrous, leading to the development of plaques formation in the heart and leading to heart attack. Because the animal meat containing lot of saturated fats, saturated fat is more abundant in the animal meat. So the consumption of the animal meat with the saturated fat leading to the development of heart attack, in turn due to plaques formation in the heart itself. So the avoid animal meat is very, very important because it containing saturated fat. If we avoid animal meat consumption, we can prevent heart attack and heart failure by at least 50%. Similarly, consumption of non-saturated fats, which are abundant in the eggs, egg white, and fish, and nuts, almonds, and flax seeds, and various fruits and vegetables. The saturated and unsaturated fats, which might be the monounsaturated fats and polyunsaturated fats. So consumption of the monounsaturated fats in particular, which are more abundant in the avocado, nuts, almonds, pista, walnuts, and various fruits, legumes, flax seeds. So these are more abundant in the and other olive oil, like that. The consumption of the olive oil, consumption of the egg white, consumption of the animal, consumption of the fruits and nuts and vegetables, it increases the good cholesterol like high density lipoprotein, decrease the bad cholesterol like low density lipoprotein and triglycerides. So the lowering of the triglycerides, lowering of the LDL, increase in HDL is possible only with the consumption of the unsaturated fats, particularly monounsaturated fats, in the form of fruits, vegetables, legumes, nuts, almonds, pista, walnuts, and various flax seeds. It increases the good cholesterol and reduce the bad cholesterol. So this way, we can prevent heart attack to a greater extent. So this is very important. Diet is very important. Avoid animal meat. Encourage fish consumption, egg white consumption, fruits and vegetables, nuts. Like with this, we can able to increase the good cholesterol, like HDL concentration, and decrease the bad cholesterol like low rich lipoprotein and diabetes. With this way, we can able to prevent heart attack. So this is the one strategy to prevent heart attack. Another strategy to improve the good cholesterol and reduce the bad cholesterol is that to regular exercise. That's very important. Avoid regular physical activity, at least 45 minutes to 60 minutes, high intensity physical activity, at least moderate intensity physical activity in the form of jogging, running, cycling, swimming, shuttle badminton, isotonic and isometric exercise, which are very important to not only to keep the body weight in optimal state, like with body mass index less than 24.5, waist hip ratio in female gender less than zero point 0.8, and male gender less than zero point 0.9. It is possible only with the regular physical activity, aggressive physical activity, regular exercises along with consumption of non-atherogenic diet, heart-friendly diet like fruits, vegetables, nuts, almonds, avoidance of the animal meat, and consumption of the thin, lean, white meat like skinless chicken, small quantity, and fish consumption, egg white consumption is immensely beneficial not only in preventing the heart attack, not only in keep the heart attack at bay, and also keep the body weight in optimal run state or optimal state. So this is one important diet and encourage high fiber intake. The high fiber food intake is very important. That high fiber is more important in fruits, vegetables, nuts. So excessive fiber, high fiber, soluble fiber is more important to prevent heart attack at a greater extent. This is the one another important strategy. Diet and exercise is very important. Another important strategy to prevent heart attack to a greater extent is avoidance of the alcohol. Because alcohol means excessive alcohol consumption. It increases the blood pressure, it increases the diabetes, it increases the high sugar levels, it increases the bad cholesterol like triglycerides and the low density lipoprotein, and lowers the cardioprotective cholesterol like HDL. So alcohol is very deleterious. So alcohol consumption, particularly alcohol bin, excessive alcohol consumption to be avoided. Alcohol, if you take alcohol along with red meat, this is more dangerous combination. Alcohol consumption as well as tobacco consumption and red meat consumption. This is very dangerous combination. So alcohol, animal meat, and tobacco. This is very dangerous combination to be avoided. Excessive alcohol consumption, excessive nicotine consumption, excessive red meat consumption to be avoided to prevent future heart attack because this is a very deadly combination. So that is another. So this is the way we can able to prevent heart attack to a great extent. So regular physical activity, avoidance of the alcohol, avoidance of the nicotine, avoidance of the fast foods, junk foods, pizza, burgers, tinned foods and canned foods, animal meat. If you avoid all these things, coupled with regular physical activity, at least 45 minutes to 60 minutes, so it's very important. Consumption of the fruits and vegetable nuts play an important role in preventing heart attack. Because why? Because prevention is more important than cure. Once heart attack is sets in, we have to give so many life-saving drugs, so many life-saving medications, life-saving operations like angiograms and angioplasty, stent operation, bypass surgery. All these things to be done. This is very expensive. These operations and medications towards heart attack is very expensive. Not only expensive, sometimes the life is in critically danger. So to prevent critical heart attack, to prevent life-threatening heart attacks, and to avoid very expensive operations, expensive life-saving cardiac medications, life-saving operations like angioplasty, stent, bypass surgery, possible only with modifying the lifestyle. So lifestyle modification is very important to thwart or to negate, to keep the heart at bay, to keep the heart attacks at bay, to prevent heart attacks, to thwart heart attack to a greater extent by simply three mantra. One is the regular physical activity. Second mantra is the avoidance of the alcohol, avoidance of the tobacco, avoidance of the animal meat consumption, as far as possible, encourage to take vegetarian diet, sattvic food, and vegan diet. Avoidance of even dairy products are also very important. That's why encourage vegetarian diet, encourage sattvic food, avoidance of the animal meat consumption, avoidance of the alcohol consumption, avoidance of the tobacco, and regular physical activity, at least 45 minutes to 60 minutes. And meditation and yoga is immensely beneficial to prevent heart attack, heart failure at bay, and overall optimal maintenance of the body weight is also encountered with this uh, lifestyle modification. Thank you, Lord. Thank you for giving an opportunity to say a few words. Wish you all the Indians on behalf of the World Heart Day, which are going to celebrate on 29th September this month. On behalf of the World Heart Day, on behalf of the Indian cardiologists, my best wishes to all the Indians to be healthy, heart healthy. Please follow, avoid all Indian. I'm encouraging my Indians to follow vegetarian diet, avoid alcohol, avoid animal meat, avoid fast foods, junk foods, pizza, burgers, cola beverages. Take good regular exercise, meditation, and yoga, and take plenty of fruits and vegetables. Also, I wish all my Indians to be heart healthy and stay fit. Thank you for giving an opportunity. Thank you so. Thank you.